Hello, doctors, students of homeopathy, and lovers of homeopathy. Let's begin the session with a silent prayer. Thank you, everyone. Today is the 1792nd day of the uninterrupted daily webinar of International Forum of Promoting Homeopathy. As you all know, IFPH is conducting uninterrupted 3 sessions every day from 7:30 to 10:30 p.m. The recording of the session is getting uploaded on the very next day so that who missed the session can watch it and get benefited from it. You can also subscribe the channel without paying any money. It is our honor and privilege to welcome today's distinguished guest speaker, Dr. Sumana Kumari Panda. Dr. Panda is a veteran in the field of homeopathy with over 35 years of clinical experience, particularly in managing chronic cases, especially obstetric and gynecology cases and palliative cancer cases at Dhableswar Homeopathic Clinic, Cuttack, Odisha. She is also a passionate teacher, having spent 18 years in the Department of Materia Medica at Dr. Abhin Chandra Homeopathic Medical College and Hospital, Bhubaneswar. Her research contributes especially as principal investigator under CCRH, Government of India, on the topic efficacy of homeopathic therapy on duration of labor. She also served as a resource person in various induction training, skill development trainings, reorientation training programs, awareness program of HMOs in organization in community organized by CCRH. She has presented and published scientific paper at national international homeopathic seminars organized by LIGA, IIPH Research Society of India, Andhra Pradesh Homeopathic Association, Tamil Nadu Homeopathic Association, and many other organizations of Odisha. Her article published in peer-reviewed journal like IJRH, PubMed, etc. She has been awarded by numerous prestigious awards like Best Homeopathic Award, Homeopathic Practitioner Award of Odisha, Hanuman Pratibha Samman in 2014 by Homeopathic Board of Odisha, Best Homeopath COVID Warrior by Marwadi Mahila Samaj, Women of Inspiration by Lions Club, Best Women Social Worker by Odisha Nari Seva Sangh, Cuttack Branch, Bharat Homeo Ratna by Wilson Homeopathy. She served through Lions Club International as diabetes chairperson to create diabetes awareness throughout Odisha and received most prestigious award, International President Medal in 2018. Today, she is presenting on the topic vitiligo and its homeopathic approach. Now, on the behalf of IFPH, I proudly welcome Dr. Sumana Kumari Panda to take the stage and share your knowledge and experience with us. Please, ma'am.
Thank you. Thank you, Dr. Smriti, for a nice introduction. Thank you very much. Good evening, everyone. So, at the outset, I am very much thankful to the organizers for giving me a chance to speak in this forum on a very good topic, that is vitiligo. Of course, this vitiligo is of our jurisdiction. In other, specifically in modern system of medicine, very limitations in therapeutic purpose, in the treatment purpose for vitiligo. And today I am going to discuss on this subject. So now I am sharing my screen. Thank you, Dr. Dhanesh, for inviting me to speak in this forum today. And I'm grateful to Dr. Sani, my teacher, who has always encouraged me to say something, to go ahead. Thank you, everyone. Is it visible?
Yes, ma'am.
Okay.
If it is visible.
So today's topic is vitiligo and its homeopathic approach. How we approach a case of vitiligo. So before going to that, we must have a little discussion about that is. So now, what is vitiligo? Is it okay?
Yes, ma'am.
Okay. So vitiligo, as we know, is a multifactorial disorder. The background might be genetic, might not be genetic, non-genetic. So that might be if in family history we are finding in parental side or in second degree relatives also, if we are finding a vitiligo, then that may be transferred to the offspring, or in non-genetic factors like specific cause is not yet known. So the pathology is not also very, the pathogenesis is also very confusing. Many more theories are with this, that this may happen, that may happen. But in non-genetic cases, it is usually we find there might be a history of any chemical reaction, might be due to friction, might be after due to a mental trauma, after the aggravated after a mental trauma, long ago trauma. So that may happen. So the vitiligo might be genetic or might be non-genetic. But usually we find vitiligo in both sides of the body. Usually we find vitiligo. It is observed that clinically no two patients of vitiligo are same with similar features. That's why etiology also varies, not the same for in all cases. It as we are having in homeopathy the individualized diagnosis, individualization. So also in case of vitiligo, the etiology might differ from person to person. So everyone is having a different etiology. So we can't say that this is the standard cause to cause vitiligo. But I have marked in many cases either the history of mental trauma, long ago trauma, or anxiety, or a fear associated with anxiety. So that might, in most of the cases, we find this is in the background for developing vitiligo. So what we find in pathology, a loss of epidermal melanocytes is the pathological hallmark for vitiligo. So epidermal melanocytes are lost in these cases. Vitiligo is usually belongs to syphilitic miasm. So melanocytes are the pigments which are responsible for the color of our skin. Okay. So melanocytes are neural crest derivatives and they reach their final place on the basal layer of the epidermis. So in basal layer of epidermis and hair follicles via a process of migration, and that is known as shading. Okay, that process specifically is known as shading. So melanocytes go to the basal layer of the epidermis. Each melanocyte then transfers its melanosomes to approximately 3 keratinocytes, 3 to 5 keratinocytes. Via a unique mechanism, what I had just told, that the shading vesicles. That process is known as the shading vesicles. In the normal skin, in the basal layer of the epidermis, for every 5 basal keratinocytes, there is a presence of a single melanocyte. A single melanocyte transfers melanosomes to every 5 keratinocytes. But in case of vitiligo, there is no melanosome transfer to the keratinocytes. That's why there is no pigment formation and the leukoderma happens. The color of the skin becomes white. and the white dots, they coalesce together and they form a patch of leukoderma. When that leukoderma is in both the sides of the body we find, and in the background we find there is some pathology, then we can term it as vitiligo. The basic histopathological finding in vitiligo is the absence of functioning of the melanocytes in the basal layer of the epidermis. What we had discussed that the melanosome is not transferred from melanocyte to keratinocytes. What stages of vitiligo, if we will say, according to the localization, that can be divided, differentiated. What is the stage? Sometimes we find the localized patches. Skin patches are limited to specific areas of the body. That variety we term it as the localized vitiligo. If that is throughout the body, we term it as generalized vitiligo. And if it is in the mucous membranes of the mouth or genitalia, okay, so what is the genital? Mucous membranes, then we can term it as mucosal vitiligo. And focal vitiligo, when there is very few spots in single area, loss of pigmentation is seen, then we can term it as focal vitiligo. What is the root cause of vitiligo? Already I had told that there is no specific root cause yet known. So many more researches are going on. The root cause is not fully understood till today, but it's widely believed to be a combination of a genetic predisposition, immune system dysfunction, and environmental triggers. Essentially, the body's immune system mistakenly attacks and destroys, as it happens in the autoimmune disorders. In rheumatoid arthritis, in psoriasis, we find in SLE, we find the autoimmune, these are the autoimmune disorders. There what happens? The defense mechanism fights within themselves. So that happens also in this case, in vitiligo. Essentially, the body's immune system mistakenly attacks and destroys melanocytes. The cells responsible for producing skin pigment is melanin, that we know, leading to the characteristic white patches. When the melanocytes are destroyed, they are non-functional. In those cases, we find leukoderma patches and we find vitiligo. The classic triad of association with vitiligo, according to the positive factors, is we find in case of mucocutaneous candidiasis, hypoparathyroidism, and adrenocortical insufficiency. In these cases are also the association of vitiligo is found. Now, how to manage vitiligo? First, we will discuss about the management, then we will go for the homeopathic treatment with the evidence-based cases. To prevent vitiligo from spreading, focus on sun protection. So we have to, these are the advices, how to manage a case. So sun protection, because after exposure to serious sunlight, like in summer, in noon, if the person is exposed to sun, then there is a destruction of the melanocytes happens. So stress management and avoiding skin trauma to the affected areas. So we have to focus on these things. And additionally, we have to, for maintaining a healthy immune system, to build up a healthy immune system, through diet and lifestyle choices are also very, very important in case of vitiligo. About sun protection, we can advise the patient to, because sunburn happens, sun damage in these cases, we have to advise the patient to use sunscreen lotions. And in cloudy days, even in cloudy days, we have to advise to use sunscreen lotions and reapply every 3-4 hours intervals in case of vitiligo, especially after swimming or sweating. And protective clothing like full sleeves, they have to put on the cotton dresses, they have to put on the hats, they have to put on and like that when they are outdoors. Stress management, where the stress managements are the triggers to flare up vitiligo. So in these cases, we have to incorporate like yoga, breathing exercises, meditations. We have to concentrate upon the stress management by through how the person can be very happy. We have to discuss accordingly what he needs, what is his problem. So that has to be taken care of. And the next is skin trauma. Skin trauma happens in skin injury like cuts, burns, and even excessive scrubbing like that. So in these cases also, and the friction, usually most of the time after new shoes, there is a friction, and I have seen 4-5 cases after friction, the vitiligo developed in both the feet. So, and that vitiligo spreads. So that is the trauma, skin trauma. So we have to take care of those, and we have to advise to avoid injuries, to be very much cautious about all these things to avoid skin trauma. Next, about the immunity, if the immunity is increased, we have to give, we have to change lifestyle management is a number one to increase immunity. How he will be very, the patient will be very happy. The sleep habit should be very good. The mobile radiation hazards should be avoided nowadays. So this is very, very important. Next is antioxidants. In diet and nutrition, we have to add much more antioxidants to reduce inflammation, to increase immunity. So in this case, we can see the foods rich in vitamin C and vitamin E. Of course, there is this is a in some Ayurvedic literatures I found that the vitamin C and vitamin E containing foods should be avoided. But the other literatures in many articles, scholarly articles, I found the antioxidants like vitamin C and vitamin E might be included. But in my practice, in my experience, I have seen that the addition of vitamin C and vitamin E helps to restrict the spread. Not to cure, but to restrict the spread. So in these cases, we can to reduce the damage of melanocytes, we have to add strong antioxidants in our diet and nutrition. While talking about antioxidants, omega-3 fatty acid is very, very rich in antioxidants. So that we will find from the flax seeds, from walnuts, like that, and other antioxidants like we find fresh fruits and vegetables, nuts specifically, and whole grain, spices, spinach, berries like blueberries, blackberry, raspberry, strawberry, like this, and carrots and beetroots are very, very helpful for which adds to the cure of to develop melanocytes, melanosomes transfer, and to develop black spots within the white patches. And vitamin addition of a vitamin B12, vitamin D3, vitamin E, folic acid should be taken care of. And what to avoid? Processed foods, alcohol, excess carbs, sugary beverages, processed foods, fish, meat, French fries, candy, all these processed foods should be avoided or in case of vitiligo. So coming to the homeopathic perspective, we find that is the whole theme is case taking. So we have to go for a thorough case taking. So after case taking, what we find the individual etiological diagnosis. So what is the individual etiology behind? And individual, so that we can go for management accordingly. And the miasmatic diagnosis, usually we find syphilitic miasm, but might be tubercular, might be the cancer miasm, might be the behind, might be psora psychosis and a syphilis multimiasmatic. So after going through a thorough case history from the physical generals, from the mental generals, from the anamnesis, that is the past history, family history, like that, we can find out the miasm, which will help us for diagnosis of the case and for the remedy selection. And the individual personality diagnosis, which is very, very important in case of a vitiligo. I have seen the percentage of cure is more where I have taken the personality diagnosis and the remedy selection was accordingly. Then sometimes also individual therapeutic diagnosis helps. So outcome, as already we had discussed, cause, constitution, totality and anamnesis. This is the general principles. For case taking, we have to gain confidence of the patient, and the life situation of the patient is very, very important to know the elements from. Why that has happened? The elements from carries the rubric elements from in mind chapter carries much value in case of, specifically in case of a vitiligo, I would say. Of course, I am dealing with the infertility and the abortion, all the PCOS. In all these cases, elements from is very, very important. That might be physical, might be mental. And the mental symptoms like anxiety, fear, the domination, the about the anticipation, about the loss of money. So why that has happened? Why the vitiligo appeared? We have to think over that, and we have to uh, probe into the matter very deeply. So observe facial expression, body language, manner of speech, behavior, etc. for the to know the personality. Okay. So finally try to complete each symptom according to the causation, location, modality, concomitant, like that. If any concomitant symptom is there, we have to find. If there is any associated symptom like itching, burning, what is the modality of those symptoms, we have to find out. So coming to the first case, case 1. In one evening, 19 February 2015, a middle-aged patient of 38, 39 years presented with white patch on both lower limbs. Okay. Large patches, the most of the left or lower limb was 40 to 50% covered with the vitiligo patches, and about 20% covered the right upper limb with the vitiligo patches. Itching was occasional and aggravation from touch, scratching. He had heartburn, flatulency, aggravation in empty stomach, relief after practice. Coming to physical generals, I found oily face, sensitive to both hot and cold climates, but not susceptible to cold. Desire salt, single plus, milk, spices, and the meat, chicken, like that. Thirst was more increased, 5 to 6 liters per day, and stool was hard, constipated. History of bleeding per annum with a hard stool, sweat profuse, and sleep was disturbed due to various types of causes. Coming to the life situation, in mental generals, it desires to be alone to feel happy. Why he was desiring to be alone? To feel happy. Okay. The company was not suits him, and irritable, very sympathetic personality. Consolation aggravates, depressed due to excessive parental control in youth. Okay. Scared of parents always, feelings suppressed due to fear, couldn't continue the study after 10th standard. Due to financial crisis, thinking always, if I would have been a very good scholar, so that I would have been getting the government scholarships to continue my study. So he was 38, 39 years, but up to that age also he was thinking that I had, he was very much fearful in his young age to his parents, very much suppressed, very depressed, but he has not told that to me. He told that if I would have been read very well in that time, then I might have reached a position in my service life. I would have got a government job during my period. Okay. So now he was at that time he was going for a business and he has concentrated. He felt guilty that he couldn't tried in his he has not tried during his student career. He has neglected his study. That was the feelings within his mind that I had uh, I had not tried. So again asking, again interacting, he told that the parents were very strict, very disciplined. So it is strong. So I found a strong depression within him, which was not vanished up to 38 years of age. And during his student period, during his schooling, he developed vitiligo. Okay. Small patches, and as the age advanced, the patches became they coalesce and they become big patches. Okay. He was very much worried about that how to establish in future, uh, how to gain a identity recognition, how to manage his family, how to gain, how to earn more from his business. So he was usually thinking about all these things. And gradually, as the age advanced, he developed a great fear for strangers. He had fear for examination during his student career and fear of snakes he had, and what I found quite during testing. He has passed a long days of hardship due to father's strict principle already, I had told you. And now he was continuing his business. Really, he is a mason. So he is working for last 12 years, and now I will say later on, after what happened after 2016 to him again, he approached me in 2024. So why he came, I will discuss. But now he is somehow established in his work and likes to listen jovial music, highly ambitious, very responsive. Another point I found, he was very fastidious in his work. The work should be very perfect. He was a perfectionist, and now he thought he has changed his mind that I have wasted my time in my student career, so I should not waste. I should concentrate in my work to earn more. And he was very workaholic also, short-tempered, fights with others for silly matters. This is a very this was very much marked with him that his friends came to me and told that in silly matters he was uh, fighting a lot, means rage, that is we can say that is he revolts. The anger has gone to a stage of rage during that period, because in a childhood he was very much suppressed, and in when he became an aged, when he became independent, that revolt. Okay. So that came into the field. So synthesizing the mental rubrics, I found that there was great anticipation, complaints after being dominated by parents, and punishment, phobias were there, anticipation suppressed, very much suppressed, and suppressed emotions. The rubrics are there. The consolation aggravation is also there. Consolation aggravation, and sensitive to criticism, fastidious, fear of strangers, fear of examination, fear of snakes, fear of dogs, and a highly ambitious, very responsible personality, a rebellious attitude, sympathetic and contented. He was not at present, at that time when he approached me, he told me that I am having a guilt in my mind, but still then I am somehow established in my business. So, and somehow I am contented with this. I am not thinking about all those things, but a kind of guilt remained in my mind. Okay. So feels relieved when alone, irritable, consolation aggravates, depressed due to past guilt. In family history, diabetes mellitus and grandparents, both the grandparents, paternal were tuberculosis, suffered from tuberculosis. In treatment history, he has already continued under allopathic treatment, next homeopathic treatment. In homeopathic treatment, he has taken natramur, arsenical, arsulflave, sepia, tuberculina. So these medicines for long years also he has continued. And after reporterization, I went with carcinosin 1M. So why carcinosin? We must discuss after finishing the case. So carcinosin 1M once in 15 days. At that time, really, I was going with the single dose prescription or 2 doses, usually 1 hour. But nowadays, I find a change I have found that if I am giving carcinosin 1M, usually I am giving in 100 ml distilled water fractional doses. So that one dose has to be diluted with 100 ml fractional, and I am giving 1 teaspoonful once daily every day. So, and that is giving more better result than the single dose prescription in my cases, what I am observing since last 5-7 years. Okay. But in case of a vitiligo, my experience deals with that no repeated prescription of the medicine. Of course, now I am giving in 1 dose in diluted, but carcinosin 1M, I have seen the indicated remedy in 30 potency, 200 potency, like that. If I in the beginning, as I was a beginner at that time, I was repeating alternate days, once daily, but that has not given me a very good result. Rather, much more aggravation happened, and with that, I had it became very difficult to manage afterwards the case. So, this is my experience regarding the doses and the repetition of the dose. Usually, I go with the 200 potency or 1M potency, subsequently 10M potency, like that, and very infrequent prescription, that is once in 15 days or once in a month, like that. But now for last 4-5 years, I am going with the diluted doses, 1 teaspoonful once daily. 1 dose in 100 ml, this water, like that. Okay. So for 2 months, I continued with this. Then in after 2 months, the patient came with small patch on left leg vanished, but right as before, and left the big patches were as before. Okay. Again, carcinosin 1M repeated, and no change. Again, after 2 months, I went with the carcinosin 1M once in 15 days for 1 month, but along with the saclet. So here again after 1 month, the vitiligo patch size as before, reddish discoloration of the patch and it's some itching. Itching worse from sweating and at night. So basing upon this, as a as an intercurrent remedy, antipsychotic, and when the improvement comes to standstill, basing upon this symptom, I went with a sulfur 1m 1 dose and the same frequency, same potency. So after 1 month, the patient came with black spots appeared on vitiligo patches, but a new patch appeared, okay, on the leg. So again I went with the sulfur 1m 1 dose, but that was followed up with R-sulfate 3x twice daily. In my experience, I have seen R-sulfate 3x also acts very well to restrict spread, to restrict not for to bring black patches, but to restrict spread of the white patches. So you can mark, this is the beginning. I have marked the, you can see the left leg white patches. These are the in thighs also, and both the sides we find these patches. Again after 1 month, the patient approached with 5 times bleeding per annum, with a hard stool, pain in the rectum during stool, soreness of anus after bleeding, no more black spots, new patch spreading. So again I went with to reduce the bleeding per annum with pain and the previous mental history also to some extent corroborates with an atramure 1m. So that's why with I went with an atramure 1m 1 dose in 1 ounce distillate, 1 teaspoonful twice daily, and along with hamamelis mother tincture 15 drops twice daily. So again after 1 month, the patient came with no bleeding per annum, no more black spots, vitiligo patch spreading slowly. So I went with carcinosin 10m, 1 dose followed by placebo 30 twice daily. So this is again after 2 months. Vitiligo patches improved, many black spots appeared on white patches. They joined together, become a big patch. No change in patch on chest region. There is no change. Again carcinosin 10m repeated. Okay. So patient came after 3 months, improving. Again placebo 30 repeated, and after 6 months, the patient came complaint standstill. So at that time, carcinosin 10m 1 dose again repeated. I will show you the picture. This is the December picture. What we have seen, this is the August picture, 20th August 2015, and this is the picture of 8th December 2015. Many more black spots appeared and they coalesced together in this area in thigh. You can mark that they coalesced together. In ankle region, they coalesced together like that. And this is the patch in August 2015, and this is the picture of March 2016. The thigh region completely vanished and the leg reduced a lot. Even if you can mark the feet, here you can mark the feet, and here you can mark the feet region. So this is in 15th March 2016. Many of the patches vanished. So this you can mark the August 2015 and September 2016. So after 1 year, this is vanished. So why carcinosin? The essence of carcinosin which supported to find out this simillimum, his cause was, here the cause was a suppression, mental suppression, mental trauma, and the mental generals helped me. Family history of tuberculosis also indicates carcinosin. Not always tuberculinum. The family history of tuberculosis may indicate carcinosin. So we have to think of that. Okay. Sensitive to both hot and cold climates, desire salt, and the sleep was disturbed. In physical generals, these three symptoms were corroborating with carcinosin, but mainly the prescription was based on the cause was a suppression mental trauma and the mental generals and the tuberculosis, family history of tuberculosis. Really, the reportization chart is here. I had said carcinosin got highest marks. In natramure, 6 carcinosin got 14 marks, natramure got 11 marks, and lycopodium got 13 marks, ignacia 13 marks. Okay, sepia 11 marks and arsenic 10 marks in this case. So that's why I went with the carcinosin, because already he has taken arsenic, natramure, tuberculinum, like that, those drugs, and that also helped me to think of carcinosin again, and the mental trauma in the childhood, that the literature writes that in excessive parental pressure with parental control may indicate, mostly indicates carcinosin. Mostly indicates carcinosin. And in tuberculinum, we find a high degree of commitment. But we find that after being grown up, after age of 25, 27, he was becoming very responsible and very a person of great commitment, very serious in his work. But we won't find in case of tuberculinum. Well, we won't find that tuberculinum is more intelligent than carcinosin. Carcinosin is more fastidious, but responsibility, commitment, all these things are more found in case of carcinosin than tuberculosis. So this is the carcinosin. Already we had discussed the suppressed anger, suppressed emotions, like that. We find in Oromurnat also we find domination children by parental pressure, but they are according to other symptoms we went with carcinosin. So this is the suppressed feeling, rigidity of behavior, rebellious attitude, fighting spirit, everything we find in case of carcinosin. High degree of commitment, feeling guilty for anything. But tuberculinum will not feel guilty. Tuberculinum for arsenic, usually we find fault finding. Both are fastidious, arsenic, carcinosin. But we find arsenic complaining nature, carcinosin also complaining nature, but fault finding we find in case of arsenic, and guilty feeling we find in case of carcinosin. Sensitive to criticism, complaints from anticipation, hypochondriac, like Nux vomica we find here also in case of carcinosin. Okay. Again, we can think of carcinosin is a very good drug with a family history of carcinoma, to prevent the trend of a cancer. In some cases we are also giving carcinosin. Okay. If we will mark the cancer cases, I have experienced a lot while treating the cancer cases, that there is in most of the cases we find a history of suppression, emotional suppression, anger suppression, mental trauma, yeah, history of abuse. But in Hindi session, I was listening, Dr. Neha Kapoor was saying that definitely, madam, I had also experienced the same in case of cancer patients. And in those cases, if acute complaint is not, the exacerbation is not there, I am also going with intercurrent carcinosin along with the constitutional remedy, and that gives a very good result in case of palliative care. A forceful personality, carcinosin. And here we find sulfur and natramure were prescribed. basing upon the present predominant characteristic peculiar symptoms, which lessened the pain and supported in removing the miasmatic blockage to facilitate early recovery. So this was the first case. Next, I will go to with the case 2, second case. In 24th June 2015, a 32 years middle-aged male person came with white patch on back of left ear, 2 small patches on chest and lower limbs. In physical generals, we find amethyr, nothing more. Desire was sweet, spices, hot food, cold drinks, and sweat profuse, offensive, sleep wakes up frequently. In mental generals, I have here a symptoms I have observed with him. In waiting room, he was sitting and in a loud voice, he was saying that this is my bag, keep it carefully. Might be to his wife, he was saying, this is my bag, keep it carefully. And to others, he was saying, you shift his bag and sit there. You shift his bag and sit there. So I observed this. That's really a very peculiar symptom. So that affected me that why not to think on this. So caring for materialistic things. Okay. And the person was very, gradually I came to know that he was very selfish. He was a grocery businessman. He was using very new skills to attract customers because he has to earn more. He was very ambitious to earn more money. Very greedy in nature, complaining nature, very angry man. And here also we found in parental uncle was suffering from tuberculosis history. So you can find that this is the picture what I had found. Vitiligo patches, and in lower limb 2 small patches, and in previous you might have seen this is the small vitiligo patch. Next, and in neck portion also, nape of neck, this is a patch, and this is the lateral one. Okay. Sulfur 200 once in a month, followed by sulfur 1 m in a month with R-sulfate 3x twice daily was prescribed for him, and the intercurrent drug was tuberculin 1 m as an intercurrent. Here we are sulfur 1 m and once in a month I had prescribed, and after 2-3 months I had gone with tuberculin 1 m in that case. Okay. So this is this here you can find this small vitiligo patch, and here you can find the large patch. You can mark here the white patch, the area is large one, and here it is reducing, gradually it is reducing. Due to paucity of time, really I am not going in detail. And here more reduced, and here too much reduced, only small patch, here small patch, and here still small because this area already vanished, this area vanished, already vanished, and here very small patch. So, and after that the patient didn't come to me, he was cured. Really, these 2 cases, they have referred me too many number of cases. I might be about 20-30 vitiligo cases they had referred me because they were cured. The Mason referred me many more cases. So this is the this is a comparison we can see. So time is short. Really, this is an atramure case. You can mark the vitiligo patch as there a large patch and many more black spots appearing after atramure. And here also many more black spots. Really, this case this is a 2016. After that, I couldn't find because within I got invitation from only before 1 day, so 2 days. So that's why it didn't become. It was not. The time was not there to find out the other photographs. Now this patch already vanished, and again another addition. He was a ISD case. He has undergone twice bypass surgery of the heart, and that is also in well condition, very good condition. Along with an atramure, I am going with a cratagus and Raulfia, sometimes Glycyrrhizia glabra, monotincture for dyslipidemia, and he is improving very well nowadays. And vitiligo patch is not there. So this is a case of tuberculinum. So my point is the constitutional remedy is the only solution, nothing else, and very infrequent repetition. This is tuberculinum, and this is a case you can mark with a sulfur on chest region. Here it has become very faded. This also you can mark that is a large patch, and here the black spots were sorinum, case of sorinum. The black patches are coming. Here you can mark, and in this case, the black patches are coming. And now, so what to observe? Calmly waiting and reading a book. Observation in waiting room, we find calmly waiting and reading a book. We may think of calculator. Fuming at the doctor for being 5 minutes late. Yeah, sulfuric acid and lively chatting away with receptionist or anyone else is phosphorus, like that. So we know all these things. So this is the very important for classical prescription, the observation in waiting room. Okay. Anxious child hold mom's hand or hide behind her. Beretta carp due to insecurity, but Beretta carp simultaneously is also very responsible and very practical oriented. Okay. Not the insecurity feeling is there. That's why the child hides himself behind. Rounded face and coming to the constitution, we may think of like this: rounded face and limbs shorter and fatter digits, that is calciracar. Thin built angular face, dark straight thin hair like a podium, and dark complexion, rounded, broad, facey face, small eyes, anemic build. We may think of natramure, relatively hairy body, long eyelashes, dark rounded body, broad face. We can think of in these cases, right? Usually in these cases, I am going for the classical prescription, especially with girls of PCOS with these symptoms and increased testosterone. I am going with the classic constitutional remedy along with testis 3x. Use my usual prescription twice daily, and the patient improves very well with that. So while dealing the infertility or PCOS, we will discuss regarding this. The hairy body, it's especially in case of girls with the beard and mustache like that. So high, fair, thin, compact, long eyelashes, thin lips, sunken chest, tuberculinum. So coming to the conclusion, due to our clinical bias, usually we depend upon the shortlisted drugs, but the drugs found after reportization, after a thorough case taking, after thorough observation, going through the life situation, the drug selected uh, acts very well, and prescription based upon the essence is the best one. Thank you. Thank you everyone for patient here. Any questions, please?
Thank you so much, ma'am. It was really very nice presentation, very informative, and I would like to invite our participants, if they have any questions, either they can raise your hand or you can type in chat box, or you can just unmute and ask.
Dr. Indranil raised hand. Dr. Indranil.
Yeah, madam, can you hear me? Yeah.
Yes, yes.
Yes, it was a good learning for us. Actually, observation was very nice. You told in the waiting room. Many times we see in our CCTV camera and then we decide the patient. In the case of Soran, which you decided, showed just now, that means the white patches on tibia. In such cases, should we take this as a clinical rubric in reparation? For example, skin discoloration white on in extremities. Do you consider this or you take the portrait?
No, sir. What I had told in my beginning practice, I was doing that. Means I can say before 30 years. But after that, with that, I couldn't get any good result. Exactly. Another point. After 5-7 years of my clinical practice, I changed that to constitutional remedy. And with that, I am getting very good results. What I missed something in first case in 2000, after 2016 the patient has not come to me again. In 2024 he visited me. So why he visited? With the relapse of vitiligo patches. So, really that photograph I couldn't collect because I told you within 2 days it became very, and last 2 days also very hectic in my clinic. So he approached me why he came. When going through the life situation again, he told me that he is having only son, and that son is addicted to now to the alcohol. What the person is very, I told you, very responsible, very committed, very fastidious. What brought him a much depression. He was not going to his job now for mason. He was not doing his work now. So he told me that my son has brought me so much depression. After that, I developed this. So after interacting for 45 minutes, 1 hour, I came to this condition. So after that, again I went with a carcinosin, and first I went with an atramure after 3-4 months. Now I am continuing carcinosin 10 100 ml fractional one dose. I am adding, and I am saying him 1 teaspoonful once in 4 days. So now he is continuing 101 dose with 100 ml distillate for 3 months, and he is improving very well improved. Good improvement.
Very nice. Thanks for the explanation, madam. Thank you for the guidance. Yeah, yeah.
So my point is to go. I have experienced only constitutional remedy is the answer, and infrequent doses, very infrequent doses. Otherwise, that will spread. The new patches will come up, and the mental anxiety we have to take care of. So along with that, yoga, meditation, breathing exercise, we have to, and the diet, we have to advise. Definitely. Any question?
Our time is almost finished.
Oh, thank you.
I
Thank you
like
very much, everyone.
ask Ram Pravesh sir if you have any
Thank
few words.
Thank you, Shruti Sarka. Very nice congratulations, Dr. Madam. Very nice, excellent session. And vitiligo. Vitiligo main cause, past history and family history are very important. In case of vitiligo, past history including jaundice, dysentery, and types of worms, etc. And vaccination is the important role.
Yes,
Case of
yes, definitely, definitely.
suppression skin disease and suppression emotional. It is many kinds. So very thanks. Thank you, madam.
Yes, sir. Our time
Thank
is
you, thank you.
finished, sir. Thank you so much, ma'am, for this very insightful and very informative session. This is very much structured and clinically applicable for us. So, thank you once again, ma'am. On the behalf of IFPH, thank you, and I like to thank participants also for their time. And I request you to come again and share your knowledge with us. It's very informative session. Thank you once again, and I would like to hand over this session to Malayalam session now. Thank you.
Thank you. Thank you. I'm leaving.